with you our experience of the thermometer system. I don't have any disclosure. So let me emphasize with the case of a 17-year-old woman with a past history of hypertension and difficulty to cope with. And her past medical history is mainly represented by valvular aortic disease and severe asthma. She is symptomatic of shortness of breath and headache, and as you can see, there is a high blood pressure office, nearly 180 millimeters for the systolic, and no signs for hypertension or orthostatic hypotension. So we perform the target organ damage, and we show that there is a huge hypertrophic cardiomyopathy with a slight impairment of left ventricular function, and no renal impairment, as you can see on the eGFR of 75 millimeters with the MDRD. So LPM show very isolated systolic hypertension with increased blood pressure variability, as you can see on the older patient, with a profile which is deeper and an average of 140 millimeters of systolic on the day. We have excluded the secondary causes. There is no signs for apnea or no signs for adrenal gland abnormality, and we perform a renal artery CT scan. And I think there is two main features that we have to see on this slide. The first one is there is a very angulated iliac artery with heavy loop, as you can see, on both iliac arteries. And the second feature is the descending bone of both renal arteries, especially in the right renal artery. There is no sign for fibrodysplasia, no signs for calcification or atherosclerotic stenosis, and if the anatomy is suitable if we want to perform a renal denervation. So our treatment is a 4 antihypertensive drug treatment associated with the central channel blockers with ICE inhibitors. There is an alpha antagonist receptor and the diuretics. So to summarize, it's a female of 70 years old which is symptomatic with an uncontrolled hypertension with a burden of comorbidity, and so we refer that for a renal denervation. At the future of the CT scan, we decided to perform on the radial axis, and we choose first the radial axis, and Thomas show you how to perform a good puncture of the radial artery with a 20 gauge needles with a straight wire in. And we use a new introducer, the glide sheet slender, which is developed by Thermo, and which is an equivalent of a 5 French outer diameters, but allow the use of a 6 French guiding catheter in the inner lumen. We use heparin and nitroglycerin. And as you can see on this slide, there is a very heavily loop of the right radial artery with a spasm. And despite every tips and tricks we learn from the coronary field, we cannot cross this loop.
It looks like the iliac arteries.
It looks like the radial, it's a iliac artery. So we decided with Jean-Paul to perform by the left radial approach, and God, as you can see, there is the same things on the contralateral side with a loop and a spasm, but fortunately we can cross this loop with a very hydrophilic wire and put the guiding catheter in the brachial artery. This guiding catheter is a climber guiding catheter which is developed by Thermo. It is a 6 French hydrophilic guiding catheter with a length of 125 centimeters, which accommodate most of the patient anatomy for an upper approach. And it is a multi-purpose shape, which in our view, for descending renal artery bone, it is the best shape to engage the renal artery. And you can see, and we see on the CT scan, that the right artery have a very descending bone. So the catheter has been presented. It's a long shift of 155 with a deflexive tip of 12 millimeters, and this deflexive tip allows the contact on the arterial wall. So, as all the denervation actually procedure, we start by the distal part of the artery near the bifurcation, and we have to push the handle to flex the tip of the catheter to allow the good contact. And the monitor allows us 4 types of information. First one is the energy. On the left down side, this is the time of ablation. You can have the temperature, and you have the impedance, the basal impedance, and the drop and the variability of impedance. The Iberis Thermo system is an energy control system. So it will deliver 8 watts of energy. So this is the goal to reach. And you have the time of ablation, which is 2 minutes by point. And the increasing of temperature, we can be very different on the position of the catheter. And as you can see, the objective is to reach a drop of impedance between -5 to -10% from the basal impedance. The pattern of ablation is quite similar than those described in the Simplicity system, with a helical pattern of ablation with 5 millimeters between 2 points, and you should make minimum of 4 points of ablation. And you can see on the right side the final angiogram without any dissection, without any perforation or distal embolization, and the classical notch of ablation that you can see on the procedure. Of course, we perform it on the left renal artery